Hi, everybody. I am Dr. Pam Stetina. I am the current director of nursing at Northern Arizona University, and I am here to talk with Monica about whatever questions she has for me.
Well, thank you. So I guess the question that we've been asking most educators is, what impact has COVID had on your current classroom experience for both you as a professor and your teacher and your students?
It's complicated. We have had at our school of nursing a little acronym that we've been using, and it's FARR, flexible, adaptable, resourceful, and resilient. So all of our communications with students and each other have included our little acronym of flexible, adaptable, resourceful, and resilient. It started out with moving all of our classes to online, and fortunately NAU had online classes, so most of our faculty were familiar with using online, but not everybody was. And fortunately we had a great IT team that would help everybody out. I'd say the biggest complication with the lecture side of things was the online testing and having high stakes exams given online using a proctoring tool that didn't work. Or the students were still able to cheat. So that was probably our biggest barrier. The other biggest barrier for our online clinical and lecture was that we have an American Indian program. And our American Indian program, and I don't know how many people know that the Navajo reservation is second to only New York City in the number of cases of COVID-19. If they were their own state, they would be the second. And because of that, they are limited to shelter in place and curfews. On the weekend, everything closes down. Everything closes down, and they are in their homes from 5 p.m. on Friday till 5 a.m. on Monday. This created some interesting teaching situations due to the lack of electricity to many of their homes, the lack of internet accessibility, and on top of that, the lack of community that our American Indians have just as a nature of the culture. We had several students that had difficulty being successful because family members had COVID-19. We had several students that had COVID-19. So being able to work with them in a way that was meaningful was probably very challenging. We had other students that were in rural communities, but I feel like our American Indian program was the hardest hit as far as being able to continue their education. The clinical side, we were fortunate for the most part in that the students had already completed more than 50% of their clinical time hands-on. So because of the Arizona rules and regulations, we were able to finish up the semester with online virtual simulations, case studies, movies, guided interviewing. So there were some things we were able to do. There were two groups that were impacted because their courses started after the semester started. And that was our accelerated students who were finishing up with their preceptorship and our graduating students who were doing public health in that second 8 weeks. The public health was actually easier to adapt because they were able to still drive around the neighborhood and do their windshield surveys, and then everything else they did virtually. And so that actually worked out pretty well. Our accelerated students, it was a little bit more challenging because the hospitals closed down. And we were fortunate that one hospital in Kingman, Arizona, which is 2 hours away, allowed for our students to attend clinical. So we had a faculty member out there for 3 12-hour shifts every week, getting those accelerated students through clinical. And we had guidelines as far as PPE, not being allowed to care for COVID-19 patients. They weren't allowed in the emergency room. And we did it. The other place that helped us was Coconino Health Department. And our students were doing intake forms dressed in full head-to-toe PPE for patients coming to get tested. So we feel really blessed that we were able to manage this on 5 different campuses. And again, the hardest hit was probably our American Indian students.
What long-term change, if any, are you going to incorporate as a faculty in the future?
I think we may see more, especially in the short term. I think we're going to see more innovations as far as clinical. So our accelerated students start clinical on June 1st, and we already are going to be doing more with them. So half will come in the lab, so 5 or 6 students in the lab, and then the other half will be doing the virtual simulations with hopefully a faculty guiding them. I think that it makes us less afraid to do innovations via Zoom. And for me as an administrator, I feel closer to my distance site. You know, I always had meetings with everybody once a month, but now I was meeting with the distance sites by Zoom once a week. And I feel that that really helped with relationships. And I think that that's going to happen as faculty revise and revamp courses. I think it's going to help us to be more of a united as a team. I think that we might do more online testing, hopefully in the classroom and not online, but do more online testing with proctors that are in person if we can. I think that that's something that we'll move to because the NCLEX is online. I think some classes will be enriched because of what we've gotten to do online. I think more faculty who are teaching online regularly are going to be increasing more in-person, face-to-face, synchronous meetings rather than having everything be asynchronous. So those are some of the things off the top of my head that I think are going to change.
What skill set have you noticed personally that you've developed that you didn't know you needed before this time?
I never knew I needed Zoom. I think for me, it's just being innovative on the fly. You know, I think we as nurses always are innovative, and sometimes it is on the fly, but having to make decisions and problem solve when I know that it might change in half an hour has been a skill set that I never thought I'd need. I think that my need to be resilient has increased tenfold. I think you have a certain level of resilience, and now it's been enhanced. I didn't know how resilient I was going to need to be, and how I was going to need to be that voice of reason when people were freaking out. And the leadership skills that you have to develop in a pandemic are different than the leadership skills that you need on every day.
So you had some people who freaked out? What happened?
I had several people freak out, and it's a continuum. So on one end of the continuum, you have the people who are into the conspiracy theories and feel like it's just another virus and this is stupid. And then on the other end, I have people who would not leave their home. Anything that came to their house had to be cleaned. They're the ones that, with the grocery delivery, they're going to spray it down with alcohol, whatever they're going to clean it with. So I really had these continuums. I had people freaking out about making sure that our students were meeting competencies doing online clinical. And what does that mean for nursing when they don't get into the hospital as much as they have in the past? And what does it mean for nursing in general? I think for me, what if we never allowed to go back into the hospitals again? And so that was my little freak out moment. But I have a lot of older faculty that are very concerned about opening back up, and what does that mean for them, and can they opt out? What does that mean for their careers? So that's the kind of freaking out that we had. I didn't really hear anybody nervous about getting COVID, even my faculty that was pretty much teaching 3 days a week. But now that it's a thing and they're forced to go back, or if we go back to in person, that's where I'm starting to hear some worriness. Mm-hmm. So I think I only had one faculty member that actually ended up getting COVID-19. I had quite a few students, most of them that were working on the front lines. And then I had some loved ones of faculty members that were sick. So
rather than knowing what an amazing nurse educator you are, how do you keep it together?
I don't all the time. I mean, that's just the truth of it. NAU has what they call Cope and Chat on Tuesday afternoons and Thursday mornings. And I've been attending some of those. I have a spousal unit that will listen to me carry on. I try to make sure that I'm getting some exercise every day. I have been trying to make sure I eat right. I am blessed to have people like yourself that are friends. I have a sister that listens to me carry on. So I think it's just being able to talk when I need to talk it out. I also had seen a counselor a couple times just to talk things through, and listening to music helps me a lot. Playing air guitar, blasting my music, singing loud, dancing. So my silly self, because you know I'm silly, so.
So how is this going to change you as a leader?
I think, again, realizing the importance of that connection with my distance sites. I knew it was important, but I didn't realize how much until the pandemic. Meeting with, I don't know that I'll meet with them weekly, but meeting with them as often as I've met with them has definitely made a difference. So I think being more astute to the needs of the faculty as a whole, especially those distant sites.
So I hear you say that with physical, geographical limitations have resulted in increased feeling of community?
Yes.
How can that be?
Doesn't that seem strange? It's because instead of making that 5-hour drive down to Yuma, we'd schedule a Zoom meeting and I can see my faculty member in person, face to face. You start seeing the body language more. It doesn't get lost in the email translation, and them feeling like they're contributing to what's happening in the big picture. I think that it created a little bit more community.
Have you had time to reflect on your traditional curriculum that has worked for many, many years versus what a new curriculum might need to look like with new skills and the future of nursing? Tell me what that is your vision.
The traditional we haven't really looked at or evaluated. So other than psychiatric nursing, we haven't really evaluated what is going to need to be changed in the long term. Psychiatric nursing, their class has always been, their lecture's always been online. And I think that it's going to change and they're going to have some more synchronous meetings. But I know our accelerated students for that curriculum, they are really looking at that overhaul and what needs to be different for those accelerated students in that curriculum. Again, they start on June 1st and we don't have clinical site placement. So that, okay, what are we gonna do? Here's some innovations. I think that they're gonna be looking at the accelerated program very carefully. I know that our family nurse practitioners faculty are looking at their curriculum as well. Do we need to upload more clinical? Do we need to start front loading didactic? Do we need, so they're looking really carefully about how can they get those 500 required hands-on hours if the clinics start shutting down because of a pandemic. So I know that the FMP team is looking at that curriculum, and I know we've already started having a lot of conversations about what we're going to do differently with our accelerated students. I don't think we've quite cycled around to the traditional students yet.
Mm-hmm. How is this going to change nursing?
I think that's my biggest question and concern. We're not going to be able to do things. There was an interesting article that talked about in the time of a pandemic and being lax on some of the PPE, and is that going to be a long-term trend? So are we going to stop wearing PPE for a patient who has Clostridium, C. diff? I think that I have some concerns about what does that mean for us as a profession. Having states that have been a little bit more lax about licensure. In the state of Arizona, they reinstituted the graduate nurse, but it's got some pretty strict guidelines about being precepted as a graduate nurse because they weren't able to sit for the licensure exam. But I know some states basically just said for 90 days you can practice as a nurse without that same strict guidelines about precepting. And I'm worried somewhere along the line somebody's going to say, well, why do they need licensure? So I have these fears, but I also feel like nurses are going to have a better voice. So I feel like nurses are being looked at as heroes, and maybe that will give us a better voice in policy making at the local, national, regional governments and policy making. Maybe the fact that we stood united to get that PPE, maybe that helps us understand we could stand united for other things. So I have some hope as well as those concerns. I have some concerns about, this is like a longitudinal study that needs to happen. Those students that didn't get a full semester of hands-on learning, what's that going to look like when they graduate and start practicing? Are we going to see a difference? Maybe they'll be able to have more clinical judgment because we forced them to do all these extra case studies and virtual simulations that made them think differently. Or maybe they'll be scared to take care of the patient. So I think that would be a very interesting longitudinal study to do.
So I imagine you've worked twice as many hours over the last 3 months as you normally have. What do you tell your family? Why are you doing this?
I don't feel that I have worked as hard as those nurses on the front lines. One of our part-time faculty was working 90 hours a week, day and night. And she wasn't caring for patients, she was caring for the nurses. She was the one helping check, making sure they understood how to use their PPE, putting it on, taking it off, taking temperatures, doing the intakes, screening visitors, because at the time they were still allowing visitors. Now they don't allow visitors. So I don't feel like I deserve what the nurses on the front lines deserve. Have I been working more? Yes, and I've been working more. I used to be really good about setting my boundaries with at 7 o'clock, I turn off, and anything after 7 o'clock I wait till the next morning. And I didn't feel like I could do that anymore. I can right now because we're in that limbo between graduation and the new cohort starting. I also was working more weekends than I had before. But I've also been married for a long time, and I have a spouse who has seen me through 3 degrees and kind of has an understanding about what it is like to live with a nurse.
Maybe I should talk to him also.
Maybe you should. He won't let you though. So
what do you need? What do you need to continue with this pace and to be successful?
You know what? I need a piece of certainty. Because in the midst of it all, we're experiencing a budget crisis. You know, if we could get anything definitive, I think that would help. Any piece of certainty that we can have, I think is important right now. Otherwise, if COVID-19 could just go away, that would be ideal to me. Just go away, please. Whether it's a vaccine or herd immunity or whatever it is. But again, I think for me, really, it's having some semblance of certainty anywhere.
Are you guys at this point planning to open up regular in the fall, or are you just still working through that? I know you have some students in June.
Yeah, we have exception for our June students with guidelines. We're working on vetting a waiver form through our legal department for summer. The university has said that we're going to open for fall. There are enough non-healthcare faculty that are worried about that, having some ridiculous number of students on campus. How do we clean in between classes? Would it be better to have a half and half kind of situation where half are in person, half aren't in person? I think our healthcare professions are going to be exceptions again because we need lab. I think that, again, I don't know that they know. I'm reading literature that says different things all the time. Yes, we should open. No, we shouldn't open. But right now, we don't know. We don't know what the virus is going to do.
Life happens.
Yeah.
And situations can either make us better or worse. What has this done to you?
Talk about a loaded question. I feel like it's made me better in some regards, because I've discovered I don't have to be at the office at 6:30 in the morning to get things done. And I've discovered different strategies for communication. I also feel like it's made me worse because I feel like I've been working a long time on not letting things get to me. So, you know, I finally got to a point where not everybody has to like me all the time. The little things didn't get to me. And now I feel like I'm stepping backwards and letting things bother me that weren't bothering me. And I think it's that unknown. So there's some things I feel like I'm doing better, and then there's other things I'm like, why are you letting that bother you? So,
if you could, how do you want history to record this event?
I think that keyword of resilience. I'd like to see, not just in my corner of the world, but as a country, that we came together as a community of caring individuals and resilience. I'd like to be able to look back, just like we can look back in 2018 or 1918. I want to be able to look back and say, the strategies that were used helped to keep it from being worse than it was. But I really don't feel like we're a community right now. I feel like it's more political than it is public health. And I'd really like to see it being about caring that your next door neighbor is okay. And not yelling at the kids down the street because they're not wearing masks.
Is there anything that has surprised you? Stories of heroism, or stories of just simple aha moments that you can share?
For me, there was a lady in Phoenix who was recognized by her neighbors because she lived in a community. She was like the young person in an older community. And she took it upon herself to go and make sure they were all okay and get groceries for them and doing everything, social distancing, the whole 9 yards. But those are the kind of hero stories. And I think that is the piece that isn't critical, is that we care for one another. It's not just the doing. Those nurses that are out there on the front lines that truly care, those are our heroes.
Thank you. Thank you for sharing your thoughts and being my friend and doing everything that you do